Greetings. Before you is Buhle Tabete, doing my second year in physiotherapy, and today I'll be presenting about the Q fever. You may ask yourself what that is. Q fever is a zoonotic infection caused by Coxiella burnetii, an oblique intracellular gram-negative bacterium. It is primarily transmitted to humans through the inhaling of aerosolized spores from the birth product, which is the placenta amniotic fluid. I'll be further explaining more and showing you more about this type of fever. Here I had explained what Q fever is, so I'll move on to the second slide. History about it. In 1935, first described by the Edward Derrick in Queensland, Australia, named by Query. Okay, I don't think this is more important, but for some reason this can be required, like knowing more about the fever and how it started and the generation of it, the history of it. It's more essential. Then moving on to the characteristics. Gram-negative, obligate intracellular bacterium, phylogenetically related to Legionella. Phase variation, extreme resilience, intracellular lifestyles. Oh, okay. In these are the characteristics of this type of fever, where we have to know more about it, which is the this is how does infection spread. The primary reservoir at cattle, sheep and goat. Bacteria concentrates in birth products, placenta, urine, fleas and milk, making purulation the highest risk event. Then we move on to the clinical manifestations. There's the acute Q fever, which is the sudden onset fever, severe headache and fatigue, migraine, chills and night sweats, pneumonia and hepatitis communis. Up to 60% of infection are Australians. Then we have the chronic Q fever. This develops in 1 to 5% of cases, often months later. Moving on to the diagnosis and treating Q fever. The treatment is acute. It's for 14 to 21 days. In conclusion, it's commonly causes of flu-like illness-like symptoms, including high fever, severe headache, and pneumonia, although many infections are asymptomatic. In rare cases, chronic Q fever can develop and lead to serious complications such as endocarditis. Prevention includes using protection equipment, practicing good farm hygiene, consuming pasteurized milk, and vaccinating high-risk groups where vaccines are available. Thank you for watching this video. I hope you get something for it.